Hi, good morning. My name is Robin. Today I'm gonna demonstrate intramuscular injection. This is my school ID, my uniform. This is all my equipment. This is my patient. First, I'm gonna check the doctor's order. I'm gonna check the 6 right of medication. Right patient, right drug, right dose, right time, right, and then right documentation. And then now I'm gonna do my drug calculation. Today the doctors has ordered with a 6 milligram of morphine. It is supplied in 4 milligram per 1 ml. So I will withdraw 1.5 ml to get a 6 milligram. And then now I'm gonna get all my supply. I use hand sanitizer to wash my hand. And then now I'm gonna introduce myself to my patient. I'm gonna knock on the door to introduce myself to my patient. Knock. I'm gonna close the curtain behind me, give my patient privacy. Hi, good morning. My name is Robin. I'm gonna be your nurse today. Please, can I have your first and last name in your date of birth? Can I check your waistband? Okay, I have 2 identification for my patient. Do you have any allergy with medication, food, environmental allergy? Okay, Mr. Smith. Now I'm gonna explain to you the procedure. Today the doctor has ordered a morphine injection. We use morphine to treat moderate to severe pain. It is just interrupt the pathway of a pain response to your brain. Side effect of this medication are nausea, vomiting, and constipation. Our concerning side effect of this medication are lightheadedness, dizziness, low heart rate, low blood pressure, low respiratory. If you experience one on these, please let me know. And then some patients are complain about a little bit burning or stinging or just be a word, Mr. Smith. Do you have any questions? Okay, Mr. Smith, now I'm going to wash my hand and apply a clean glove. I use hand sanitizer to wash my hand. Now I'm gonna apply a clean glove. Okay, Mr. Smith, now I'm gonna check my supply. I have my vial and then I have my 3 ml syringe. And then I have my 22 gauge 1-inch needle. I'm gonna attach them together. Okay, now I'm gonna use alcohol prep to clean out the top of the vial. And then now I'm gonna withdraw 1.5 of air, and then I will inject that into the vial. I'm gonna inject that into the vial. And then I'm gonna withdraw 1.5 milliliter to get a 6 milligram. I'm gonna type for any air bubble. This is my 1.5 ml dose. Okay, I'm gonna safety type for air bubble. I'm gonna type uncap. I'm gonna uncap safety uncap. I'm gonna cap the needle back, and then if I withdraw this away from the patient, I'm gonna label the medication and the dose. And then now I'm gonna select the site, and then I'm gonna make sure the patient is laying in the supine or lateral position. And then today I'm gonna use the ventrogluteal side, and then I'm gonna make sure the heel of the hand, on the greater to the center, and then the waist is almost perpendicular to the femur, and then the thumb on the patient groin, and then the finger up to the iliac crest, and then also I'm gonna make sure in the iliac crest that the site between the index finger and the middle finger, and then that the iliac crest. And then now I'm gonna inspect for any muscle site integrity, bruises, discoloration, and then I'm gonna palpate for any edema, tenderness, and then masses. And then if the patient has a recently an injection, I'm gonna make sure to check the site recently. And then now I'm gonna use the alcohol prep to clean the site. And then I'm gonna do the circular motion from inside out, about 5 centimeters. And then I'm gonna let them dry without blowing or foaming. Okay? And then now I'm gonna hold the skin, and then I'm gonna use the other side of my non-dominant hand, and then I'm gonna hold the skin nice and tight while I administer the medication. Okay, now I'm gonna hold the skin, and then I'm gonna inject the medication in the lateral traction, and then about 90 angle. Okay, now I'm gonna support 90 angle. I'm gonna support the needle with my finger, and then I'm gonna inject slowly the medication. I'm gonna inject slowly the medication about 10 seconds per ml, slowly. And then I'm gonna hold it about 10 seconds before I withdraw the needle. I'm gonna make a little bit traction, and then after that, before I remove the needle, I hold it for 10 seconds, and then now I'm gonna remove the needle slowly. And then I'm gonna put a gauze. I'm gonna put a little bit pressure, and then I'm not gonna rub it. Okay, if the needle have a safety mechanism, I will initiate that safety mechanism, and then I'm gonna put the needle in the sharp container. And then I'm gonna remove the gauze, and then I'm gonna make sure I'm gonna clean everything after that, and then discard everything, and then I'm gonna make sure my patient is in position comfortable, And then I'm gonna remove my glove, turn it inside out. Turn it inside out. And then I'm gonna sanitize my hand. And then I'm gonna make sure my patient is on position comfortable. And then I'm gonna document my procedure, give my patient privacy, and leave close the curtain. Thank you.